Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Welcome back to the Southern 7 podcast. I'm Shawnna and Rhonda, and joining me today is Rhonda Andrews-Ray. She is the Executive Director and Public Health Administrator for Southern 7 Health Department. Rhonda, I'm so glad to have you with me.
Thanks, Shawnna. I'm happy to be here.
Oh my goodness, we're here in our nice little spot and talking about all things Southern 7. But before
Lots of things.
Lots of things.
Lots of things.
Before we do that, tell us a little bit about yourself. How did you get into public health and how long have you been here?
Oh boy, how did I get in public health? I do not have a degree in public health. I got my first job in public health probably because they couldn't hire anybody else, if I'm being really honest with you. I was hired to replace an administrator that was retiring. I happened to have a related degree to public health, and so they took me when I was in my 20s. I won't tell you which 20 I was in, but I was in my 20s, and I have been in public health now for 28 years, I believe. 3 different health departments. This is the first multi-county health department that I've worked for. I've done lots of things prior to this. Other health departments I've worked in, we've had home health and hospice, doulas, just all kinds of really neat things. Then I got here to 7 County Health Department where we have Head Start, so that was a whole new animal. There's only 2 Head Starts that are managed by health departments in the United States. We are one, and there's another one I believe in Texas, so that definitely sets us apart from other agencies.
Wow.
Yeah.
So you got an extensive background, and kind of like a lot of people that get into public health, we kind of get jumped into it a little bit.
Yeah.
So
it's not really where I intended to be.
Yeah.
I intended to be, I think, probably out in the woods somewhere doing some research work, but that's okay. This has been right up my alley. It was the love in my life I didn't know I needed. So.
Well, you do an excellent job.
Thank you.
I know I work here too, but I am amazed at everything that you do every day and are able to get done. And it makes me work harder, so I'm excited about that.
Thank you.
Well, let's talk a little bit about Southern 7.
Okay.
We've probably got some folks that don't know a whole lot about us,
Sure.
or maybe have just only come if they needed a COVID shot.
Yep.
So give us a little bit of history about Southern 7.
Southern 7 is 42, I believe, years old. So it was originally a quad county health department and a tri-county health department that joined forces to make a 7-county health department. The largest county health department in Illinois, not largest by population, largest by square footage, definitely. 2,003 square miles is what takes place down in Southern 7, and we are about the size of Delaware. So if you can imagine the state of Delaware, and we have 1 Walmart in the state of Delaware, and three McDonald's in the state of Delaware, and lots of cows and pasture ground, and forests and rivers, and all the beauty, you know, have lots of beauty down here. Not a lot of people, about 65,000 people. So it's rural health department, the most rural health department I've ever worked for. The health outcomes, because we are so rural, there's a lot of poverty down here. The health outcomes in the Southern 7 is some of the worst in the state, which is, you know, sad. It's not what you want. It gives the health department a lot of room to help, which is a good thing, and that's what we're all about. We're all about changing people's lives and making a difference and trying to help them, you know, help their health and help them have a better life.
Exactly. And so, you know, being able to be out there in these communities and talking with the folks that are here, it is amazing to meet with them and to, you know, you talk about there being 1 Walmart and just,
you just don't know until you experience it.
But for the people that aren't too familiar with our region, it's hard to even imagine that we don't have advanced medical care.
Right.
That we have 3 primary care hospitals in our region, 2 basic health clinics. Our folks really are struggling.
They are really struggling. No OB down here, so none of our hospitals deliver babies. I believe each hospital has 25 beds, so we have 75 beds in 7 counties in Southern Illinois. Lots of people go outside of the state for services. Some people might go up to Carbondale, some people go to Cape, Paducah, Evansville, some places like that, they go for care because there just isn't a lot offered here, especially if it's specialty services. So, you know, like I said, it gives the health department a lot of room for growth, a lot of room for helping. We do a myriad of different services. Everything from genetic screenings, we have the WIC program, of course we do immunizations with COVID, with hepatitis, communicable disease investigations, the environmental health, so we do food inspections, we do water well inspections, we do mosquito testing for West Nile virus. Lots of health education programs. We do coordinated health in schools, adolescent health. We do teen pregnancy prevention, emergency preparedness. I could go on and on and on and on and on. Head Start is about half of the health department's budget, so it's obviously a very big piece of the health department. Head Start has lots of employees. We've got lots of different centers out there. We have early Head Start, and we also have traditional Head Start, which is your 3 to 5 year olds. Earlies are pre-3-year-olds prior to that. So, you know, lots of services and things going on down here.
Well, and as I go out and talk with people as part of my position here, it's really interesting to me that folks really don't know that they can benefit from the services of the health department. They often think, okay, well, I have to be of a certain income level.
Correct.
Or a certain need or whatever the case may be. And that's not true. If you live in the lower 7 counties,
Right.
you benefit.
Absolutely.
from those
I mean, if you are a farmer and you're outside digging a ditch or building a barn or doing something and you accidentally get a nail in your hand, there's no reason for you to go to the ER to get your tetanus shot. You can come to the health department. You don't have to be on any kind of specific income level. You don't have to have a specific job or a specific place. You know, you can call the health department, and many times the health department can get you that service much less expensive than you would go to another place to get it.
Right. And we do have a health department in each of our 7 counties.
Yes, we have a presence in each one.
Okay, so you do have a clinic near you.
Yep.
And the resources near you as well. Let's go back and talk a little bit about Head Start.
Okay.
How did Head Start come under the umbrella of the health department?
That's a good question. It's kind of pre-me. The only thing the things that I can tell you, I'll tell you the things that I can. Head Start has to be hooked up with what's called a CAP agency. So you have to have an agency that will administer that grant. And so the health department was one that could administer that grant. Now I believe I'm correct in saying this. I think before the health department it belonged to SIU. And I don't know how that transition occurred. It was many years ago,
Okay.
Very early in the health department's history. So, you know, I like I said, I don't know how that occurred. I just know that now we have that program and we've had it for a long time.
Right, and we'll be learning more about the Head Start program as we start talking with our directors there. But yeah, just to understand how it came under it, a lot of people also don't know the connection between Southern 7 and Head Start, and that their children can
And you know what, it is a beautiful connection. I don't know why this isn't done in other places. The health department is able to offer services to those Head Start kids very easily. You know, now we're doing services through the WOW van, which is our Wellness on Wheels van. All we have to do really is to take that van and put it in the Head Start parking lot, and they can take those kids out to get the services that they need. So that's, you know, it like I said, it's a beautiful connection. I don't know why other people haven't thought of it, you know, in order to do it, but it works out very well.
Very good. Okay, well, let's talk about life. I guess it's not post-pandemic. But how has life changed for the health department? What did we do in order to help people in the community, and how has it changed now that we're kind of on the downhill slide?
Yeah, the pandemic, I think if you ask anybody at the health department now, it's a blur. I mean, it happened so fast. It seemed like we were gearing up for the pandemic, and then all of a sudden on April 1st of, I think it was 2020, we got our first case. And from our first case, it just rapidly took off. It was like a screaming freight train. And we had to learn very quickly how to deal with that. I mean, we already had plans that were set up. We do emergency preparedness all the time and have for years. So it gave us a chance to take those plans that we had and go ahead and put them into place and start using them. So we quickly set up an incident command team, which, you know, we have at the health department. And so we could kind of talk through logistics and how are we going to contact trace these people? How are we going to get a hold of them? Do they need resources? Do we have logistical concerns? You know, all those kinds of things that we needed to talk about. And now that sense of urgency, I almost don't want to say it's completely past, because we're starting to see a little bit of re-emergence in it. But it's not the big scary monster, I guess, that it used to be. Now it's seen as something that we can manage a little easier. I mean, I don't want to make light of that in any way, because it's a very serious illness, and a lot of people have become very, very sick, and many people have died of it. You know, and that's why we're in the business of giving vaccinations, and have been, you know, since 2021. I guess probably even December, I guess, of 2020, we've been doing those. So we've been doing them for quite a while. I know that the National Guard had come in for, I believe, March 3rd of 2021 to July 1st of, no, I gotta think about this, March 1st of 2021 to July 1st of 2021. So we're at July 1st now. So a year ago, the National Guard was dispensing, and they were leaving the area. And so we started giving shots again. As of May, the health department, not National Guard, but we had given, I believe, 7,089 COVID shots.
That's a lot.
So, and we're still doing them. Every time the WOW van goes out, that's the majority of what they're doing, is giving COVID shots, and we would encourage everyone to get immunized against COVID, because it definitely, it lessens your severity of symptoms. I can tell you that firsthand. I've been vaccinated. I have had COVID. I did not experience a severe case at all, and I very easily could have, due to underlying health things, but I did not, and so that was a good thing. I know not everybody experiences that, but I know a lot of people do. They have a less severe case, and so we're still in the business of giving those shots. We're still in the business of doing some contact tracing if it's for congregate care facilities. We're not out there doing one-on-one contact tracing. That's done by the state now. So that's kind of taken a little bit off of us. But it's still a concern, you know, especially when our counties are going into high transmission rates or medium transmission rates, which a couple of ours are doing. I believe we have 4 this week. 2 of them are high transmission and 2 of them are medium. So, you know, that gives us a little bit of cause for concern.
Sure, exactly. And, you know, we had so many people that we partnered with. You mentioned the National Guard.
Right.
But just the hospitals that we worked with, the people that came out, we had volunteers that helped us get through that. And I'm one of those people that tries to look on the positive of things as much as I can.
Right.
It does prepare us for anything moving forward.
It sure does.
It showed us what we can do as a region, as just as a team.
Yeah, all the EMAs had to work together, hospitals had to work together. You know, we talked many times to different hospital officials, nursing homes. You know, we would work to get them personal protective equipment. We would, you know, work to get them masks and respirators, whatever, you know, it was that they needed. Some of them needed to be fit tested, you know, so that they could have their masks that were fitted well. And we did a lot of those kinds of things with people.
Exactly. Let's talk about what's coming.
Okay.
And again, we're trying to, here at the health department, we're always looking at past COVID, but not just in that, we're always looking forward, because that's what a health department does, is constantly looking at new ways to help people in the region, those that they serve. So is there anything new going on?
Probably the newest thing that we've got going on right now is a couple of things. The first thing would be, of course, the WOW van. The WOW van is an acronym, stands for Wellness on Wheels. We have been taking it every Wednesday. It's a state motorized mobile clinic unit, and we have been taking it from place to place on Wednesdays, usually 2 places a Wednesday, and providing all kinds of services, everything from getting your COVID shots to we're even doing Narcan screening, or Narcan training out of that, and dispensing Narcan kits. So those are some very good services. They're free services. Don't have to pay a thing, don't need an appointment, you know, you can come and do that. We have recently wrote a grant where we can expand that so that we don't do it 1 day a week, we're able to do it 5 days a week. I'm hopeful that that will be received and approved. We have not received approval on it, but it is out there. You know, we're trying to do some health equity work to where we can get into some of these neighborhoods where the transmission levels of COVID are high, but yet the vaccination rates are low, and trying to get out there and do some of that work. You know, we're doing fecal immunochemical testing kits, which is our colorectal cancer program. I'm super proud of that program. It's a passion of mine, has been a passion of mine for about 6 years now, and doing a lot of great work through that. We've, you know, Shawnna, you yourself work on that program and doing a great job, and Patrice is helping you, you know, on that program, and we're able to get into some of those communities that we haven't before and get some of these people screened. And traditionally, we have seen higher positivity rates than we have in to what would be the average of the United States, which is 7 to 12%. And I know in some of our years we've had upwards of in the 20, you know, like 25% plus positivity rates. So, you know, a big, huge need down here. The other thing that we've kind of got going for the future is we're working in Polk County in Golconda, and we're going to be opening actually on July the 6th, which is next Wednesday. We're going to open our clinic there. We will have a home-based teacher for Head Start, and we will provide public health services, which will be all of our immunizations and that kind of thing. And eventually, which eventually sounds like a long time, but it'll actually only be a couple of months, we'll be doing WIC and case management out of that office. The plan is to renovate it so that we can have 2 early Head Start classrooms, and we'll be able to serve 8 children in each classroom, which daycare is in extreme need over in Polk County. So we're very thrilled, you know, to be able to bring that service to the community. So the future is looking bright.
Yeah, and when you talk about the Polk County location, you know, right now the clinic is only there like a half day, 1 day a week. And so it's been kind of difficult to get in touch with people going forward.
Right.
We're going to have somebody there that can answer the phone and at least get you connected.
Yes, the home-based person will be based out of there. So except for when she's out doing, you know, her home-based visits, she'll be able to answer the phone, direct people. But as we add more services, we're going to pick up more time there. So our plan is to where we can be there 2 days a week. We will provide public health service on one, and then we'll do WIC and case management, which is also public health, but we'll do that on a separate day.
Well, and you know, we get people that ask, well, how come you're not open every day at all your locations?
Well, I wish we were. I really do. It's not that the need is not there. The need is there. The problem is we don't have enough staff. You know, like everybody else, there's staffing shortages, and boy, oh boy, have we seen it here. And I'll put our shameless plug in. If anyone needs a job, we've got lots of positions available. You can check out our Facebook or our website. I believe we have about 20 vacant positions, which is a lot for us. Normally we carry, you know, 10 or so, but it's a lot. Public health nurses are definitely needed, and if we had more nurses, we could open up these services. That's really the only limiting factor for us right now.
Yeah. And the other thing that's new, we just recently created an app, Southern 7 app.
Yes.
And you can go to wherever your app store might be and download that, and through that you can get connected with our website and all the services that we have, as well as download our podcast.
Yes.
So we encourage people to do that. We're growing and changing all the time, and it's lots of fun.
Yes, we are definitely growing and changing.
Anything else, Rhonda, you want to mention?
You know, I would just say to the public, if you haven't been to the health department, check us out. We offer lots of services to lots of people that are not necessarily income based. Some things are, but not everything is. And you might, you know, we're in the business of changing lives and making a difference, and if you give us a try, we just might make a difference in your life.
Exactly. Wonderful. Well, thank you so much.
Thank you
for being
having me.
My first guest.
I'm the guinea pig.
On the Revised. No, you're awesome. I mean, it's not the first time I've interviewed you on things, so hey, we got that going.
Yes.
So that works out really
good.
Great. But thanks again, Rhonda. I appreciate it very, very much.
No problem. Thanks, Shawnna.